Hi, Jim Paoletti, pharmacist, fellow in functional medicine. I'd like to talk to you about estrogens. Probably the hormone that's more confusing to most practitioners when they first get started. There's three major estrogens in a woman's body. Estradiol is the strongest estrogen and the one you see most of the literature about. It's about 12 times more potent than estrone, known as E1. Estrone is primarily the postmenopausal estrogen. It's dominant then and it's produced mainly from the adrenals at that point. Estrol, the weakest of the estrogens, is about 1/80th the strength of estradiol, but it has a very important role in the human body. Now, when we first started replacing natural estrogen in women, we often used a formula called Triest, which was made up of those three estrogens, 80% estradiol, 10% each of the other two. Over the years, that has changed. We don't need to include estrone in it because estradiol is converted readily to estrone in the body, so we can leave the estrone out and make it biased with estradiol and estrol. We've also changed the percentage that's most commonly used. Instead of 80% estradiol, more recent studies have shown that maybe that should be lower to be more physiological. So what we start most women on now is a 50-50 preparation. It's very important to remember that estradiol can modify the effects of the stronger estrogens on the estrogen receptor. It can actually block estradiol and estrone from working. It's kind of like tamoxifen in its action along those lines. So it's a safe estrogen. But also, on the other hand, if you use too much estradiol, then you're blocking the effects of estradiol, which will then require higher doses of estradiol to get the clinical effects you're after. In increasing the amount of estradiol, you're increasing the metabolites that could possibly start cancer. So what we try to do is imitate a physiological balance. We start out with 50-50, and then you can adjust those levels of each within the formula based on an individual's response. And you can download, we have dosage guidelines on all the hormones, males and females, that you can download for more information.